We're here to update everyone on what is going on with Nashua, the status of our efforts to combat the coronavirus and to contain its spread. Our overall objective, of course, is to keep our residents, our citizens, as safe as we possibly can. And therefore, we want to contain the spread of the virus and treat anybody who contracts the virus. In addition, one of our primary goals is to prevent the overwhelming group of patients at any hospital, the kind of things that we've seen in New York City. Now, I did over the last few days have the opportunity to speak to both a doctor and a nurse who work in New York City hospitals, and the situation down there that they describe is something we do not want to happen here in Nashua. Their words were Armageddon, very crowded, way too many patients, people dying even in the ER. So that's not where we want to be. That's what we're trying to prevent here in Nashua. So we have a big community effort, and I'm very proud of how everyone that works for the city and many other community members have joined together to do the best job that we possibly can. And we have many heroes. Those include the people who work for the city, people who work at the hospitals, our healthcare providers, even people who work in the groceries and in the supermarkets, who are making it possible for people to be able to get the food that they need. Now, I'm going to describe some of the things that are going on here just so that you have a sense of it. After I update you a little bit, then we're going to hear from Bobby Bagley, who's the Director of Public Health and Community Services, and Justin Cates, who is the Emergency Management Director. We are doing a whole number of things that we think will help defend the community. First of all, we're enforcing and we're encouraging social separation. This is very important. Keep people apart so that if there is someone who has the disease and does not have symptoms, to make sure that they do not spread it to others. So we are instituting and we've been reinforcing this as much as we can. We've closed our parks, we've closed our playgrounds, done things like shut off the basketball nets to keep kids from congregating at basketball courts. We've left the big parks open, but we are encouraging people to stay 6 feet apart as they use parks such as Mine Falls and Greeley. But we are instituting a social media campaign to reinforce the idea that people should stay at home as much as possible. That is, of course, what the governor has suggested and ordered and what we see occurring around the country. So we've got an I'm Staying at Home, which we are posting on the Facebook page, and we are going to be asking people to complete this and post it on their own pages. I'm staying at home for, and then give their own personal reason why they're exercising what we call social distancing or physical separation between people. But also on the city website, we're trying to inform people as much as we possibly can. We have a COVID-19 section of the website, and you can click on that and you can find out many, many things about our response. It will update you on closures of businesses, restaurants, and the like. It will update you on what city services are being provided, and it will provide important alerts regarding things that are going on. Now, the city, of course, City Hall has been closed for about 2 weeks now. We are delivering only essential services, police, fire, public works, garbage collection, and other things that people really need. There's been a very coordinated effort to try to feed the kids that do not have enough to eat and who normally get breakfast and lunch at our various schools around the city. The transit system, Nashua Transit, has been working together with United Way and many community volunteers to pack up meals every day and deliver them to various sites around the city. There are 4 routes going on. Though it started last week, then we went to 3, now 4 routes. We start at Nashua North, and then each of 4 buses goes to various sites around the city. In addition, the school department, which of course is closed till at least May 4th, is offering meals at a number of the schools, and kids come in and can get meals at the schools. So I'm very proud of that community effort, the volunteers, United Way, and everything else. In addition, Public Works coordinated a donation drive in which they collected various materials that can be used by the nonprofits and by some of our first responders, things like hand sanitizer and gloves and other protective garments and the like. And they were able to collect over the course of a few days a whole truckload of things which were delivered to the United Way, and in turn were being distributed to the nonprofits and to our first responders. Director Bagley is going to update you on some of the details of our the cases we have here in New Hampshire. But I will just, here in Nashua, I will just say that we do have 42 cases at this point, but our public health nurses are doing a great job in terms of not only documenting each case, but helping to care for each case, each person who has been infected with the disease, and also investigating all the contacts that any person who's tested positive may have had over the preceding days, so that we can try to decide who should be quarantined, and then in that way contain the spread of the coronavirus. So again, I wanted to thank everyone for this huge community effort. We're here at the police department. They've been very cooperative as well, and I see the chief here. They've been going around the city and reminding people when they see groups of people that they should stay apart, that they should exercise the social distancing and stay at least 6 feet apart. In any event, to at least conclude, we're working very hard. I'm very proud of the community for all of the team effort that has developed, and I'm optimistic, cautiously optimistic, that through these efforts we can limit the extent to which this virus spreads around Nashua and our surrounding area. So I'm going to give you Bobby Bagley, Director of Public Health.
Thank you, Mayor. I'm going to share some statistics with you about the coronavirus pandemic. Total cases globally. This morning, over 941,900 cases were reported in the United States. At this current time, that number may look different because this is a very ever-evolving situation. It was reported that there were over 47,500 deaths as well. In the United States, it has been reported that there are over 216,700 cases with over 5,100 deaths. That number may be higher even now because this is a number that reflects only those that have been tested. The majority of Americans are now told to stay at home because we realize that this is being spread in our communities. In New Hampshire, we've had 415 cases, 22% which are recovered. 14% have been hospitalized. In Nashua, we have 42 cases, just as the mayor just said. At the health department, the public health nurses are investigating over 104 contacts and are following those contacts and contacts to those contacts. Next week for us kicks off National Public Health Week. And the goal of Public Health Week is usually to promote things that help us to have a healthy community, a healthy nation, community by community. COVID-19 presents as a challenge for us presenting and accomplishing this year. But as a community, we can work together to stop the spread of COVID-19 as we look to achieve the goal of maintaining as healthy a community as we can. We can all save lives by adhering to the stay-at-home order and maintaining social distancing. Now is the time for us to aggressively and intentionally work on doing this in the midst of this ever-evolving event. Social distancing is the key. We can maintain our health, we can maintain our well-being, and our most vulnerable in our populations and in our communities by seriously taking advantage of the ability that we all have. It's within each and every one of our power to maintain and control this outbreak. Only go out to take care of the most essential things. You determine what that is for you. There is a stay-at-home order in place in 87% of the states in our country right now. Many people are working from home. Businesses are closed for that very purpose of lowering the number of people that are in one place at a time and decreasing for the need for people to be out together in public. Our schools are closed for that very same reason, to prevent our young people from gathering together. Churches are closed for the same reason. Staying at home will help us to save lives. Your staying at home is you doing your part to help prevent infections and, again, save lives. How are you doing your part? Let me tell you how serious COVID-19 cases is right now. We're expecting a peak in some of our states in mid-April, such as in New York. We in New Hampshire may experience a peak in late April or maybe even early May. Let's work together to flatten this curve. Our hospitals, we're working jointly together with them now in preparation for what could potentially happen. Our hospitals will not be able to take a huge hit or a spike of cases at one time. We're currently setting up an alternative medical care site at Nashua High South that will be staffed by nurses and clinicians from both of our hospitals at St. Joe's and Southern. It is up to each and every one of us to prevent the spread of this contagious infectious disease and help us maintain our workforce at both hospitals, as well as our first responders with our Nashua Police Department, our Nashua Fire Department, and AMR. This disease is very contagious. There is still no vaccine, and they are still working on the best treatments for the illness. The signs and symptoms of COVID-19 are fever, which can range from low grade to high grade, shortness of breath, muscle aches, headache, something as simple as a runny nose, sore throat, and even diarrhea. Some people have had all of these symptoms, and some have had maybe one or two of these symptoms. It presents very differently in everyone. Stay at home. When you go out, maintain your social distances from one another. Stay at least 6 feet from others. Wash your hands often. Disinfect surfaces frequently. Do not gather in any place in groups of more than 10. I've been able to see in our supermarkets how they've made and put measures in place to help us to do this. Our goal is to keep the infection rate very low so we can flatten this curve and prevent a quick surge of cases occurring in our community. Many will get sick, but many of those may have mild symptoms. The recovery rate of COVID-19 is high, but there are some who will become very sick. There are some that will be deathly sick, and there were others that may even die. It's hard to know how different people will be affected, so the best thing that we can do as a community is to prevent as many people from becoming sick by staying at home. I cannot emphasize that enough. Only go out when it's absolutely necessary. If you have to go to the supermarket or drugstore or out to places, go out just for your essential items. We can all play a very important role in the safety of not just ourselves, but of all of those that are around us. We are our brothers and our sisters' keepers. What does it look like to stay at home? The weather will get nice, and you will want to be outside. Walk in your community, but not in groups. Maintain your social distancing. Play, run, be active, but not in large groups. Maintain your social distancing. Talk to your children and talk to your teens about the importance of social distancing. None of us are immune from COVID-19. Enjoy family time outdoors. Play video games, play board games, do puzzles, enjoy family time. Take this opportunity to do this. Unless someone in your household is showing signs of and symptoms of the illness, take this time to be together. Engage members that have to be in isolation or quarantine through social media and FaceTiming them. For those who may have to go on quarantine and isolate yourselves in your homes, make sure you wash your hands often. Disinfect areas where you are. Clean the bathroom after you use it, after each use. And stay away from your family members as best as you can to protect them. Again, we all have the power to help stop the spread of this infection by taking this very seriously. Our work together as a city, as a community, under the leadership of Mayor Donchez has been phenomenal. We have worked extremely hard to help mitigate and contain the spread of this infection. And what we're asking our community is to work with us. Stay at home, maintain your social distancing, and be kind to one another. Thank you.
All right, good afternoon. I'm Justin Cates, the Director of Emergency Management here for the City of Nashua, and I just wanted to cover some of the actions that the city has taken regarding the emergency planning, response, and recovery that we'll be dealing with over the coming months. So the city had started planning for the COVID-19 response all the way back to mid-February, and really the only reason we were able to engage that early on was because we have a full-service public health division that's very robust and capable of handling all the activities that need to be done when it comes to a public health emergency response. We also have an Office of Emergency Management here within the city that's working to coordinate all the city divisions, departments, and other community stakeholders to ensure that we're ready for this type of response. On Monday of March 16th, we started operating in a virtual emergency operations center environment. We're actually today sitting in our physical emergency operations center, and you'll notice that there's nobody in the room. And the reason for that is because we've been able to work remotely and engage in that physical distancing that we've talked about. All of our key stakeholders and decision makers are working right now from their homes to handle this emergency and handle the coordination that needs to take place. We've also had a daily team briefing with the Unified Command here within the city at 10 a.m. every day, even on Saturdays and Sundays. And the idea behind that is to have a cadence that we can continue to try and ensure that all of our city divisions are aware of the most up-to-date information on COVID-19, as well as the actions that they need to be taking throughout the rest of the day. Early on, we established 5 task forces, multidisciplinary task forces around specific problems that we were either experiencing in the community or we expected to experience in the coming weeks. The first one, the most obvious, is the Public Health Response Task Force, which Bobby has talked a little bit about some of the actions that her office is taking to work through this crisis. But I want to talk in detail about some of the other task forces and the actions that they've been doing over the past few weeks. So municipal continuity. As the mayor had mentioned, City Hall has been closed. Many of our other city departments that are performing what we would consider to be not essential services have been working remotely over the past few weeks. And this has been an opportunity for us to prevent the spread of the infection throughout our city facilities, as well as the constituents that are in those facilities on a regular basis. That doesn't mean that our services are completely shut down, though. Many of our city divisions have found very unique ways to continue their services remotely. And for those other city divisions like the police department, the fire department, public works, they have to be out there in the community. They have to be able to provide services in the same way that they've done in the past. So they're being very agile when it comes to how they're responding to calls and dealing with those conditions that might be hazardous to their personnel. The School Issues Task Force was another one that was established early on, and the focus of that was to work with the school district on collaborating on ways to support their remote learning initiatives, as well as the feeding of children across the community. And we've been working in close concert with the school district over the past few weeks on the actions that they're taking and how the city can support them. Community distribution was another task force that was established with the focus of identifying those services and goods that need to be distributed across the city to those who are not able to deal with their routines when it comes to going to the grocery stores or pharmacies or those types of locations. And as the mayor had mentioned, we've been able to work in very close relationships with the United Way and other nonprofit groups who are out there distributing supplies and materials to our most vulnerable here in the community. The Economic Recovery Task Force, which is headed by our Economic Development Director, is focused around looking at the long-term impacts of the COVID-19 virus and disease that we're experiencing here within the city, and what types of impacts it has on businesses, nonprofits, and the community health as a whole. And so they've been working to identify those programs by federal and state agencies and identifying what types of resources we can get to those businesses to keep them solvent and also to ensure that they are able to recover quickly after this is over with. We also established 2 additional task forces within the past few weeks, and the focus of those were to deal with some emerging issues that were popping up. And the first one is the Homeless Support Task Force. We were working regularly through our welfare department with the shelters within the community to identify services that could be provided to that community and make sure that they're able to still receive the essential services that they need. And then also the Child Care Task Force. There's been a lot of work done by Child Care Aware at the state, as well as the state DHHS, the Department of Health and Human Services, around coordinating with child care centers and ensuring that essential employees can get those types of services. We wanted to make sure that there was a person in the city assigned to that task to coordinate with those other agencies. This is all being done through a unified command done by the Public Health Division, our Office in Emergency Management, as well as the school district, the 3 entities within the city that are trying to lead this effort under the mayor's authority. And this is unique for us. When we're typically dealing with emergency situations, it's a very government-led response in most cases. But because of the nature of this hazard that we're experiencing, we have to work with the entire community. We have to work with the nonprofits. We have to work with the businesses. And they have to sit at the same level as us within the government on these task forces. So each task force has a representation from the business community, from those nonprofits that provide services. In addition, we've also worked to establish a Joint Information Center. And the Joint Information Center is a concept that enables all of the outward-facing public relations folks within our city government to work and coordinate together on messaging so that's unified across all of our city divisions. And so now you'll find those public relations officials in our transit department assisting public health with the response to public messaging, graphics, many of the things that you've probably seen on social media over the past few weeks. And it's a great concept, and it's working really well here within the city. The other thing that I wanted to quickly mention is the COVID hotline. This is something that was established by our Joint Information Center in conjunction with Public Health to enable citizens, businesses, and other entities to be able to get directed to the correct agencies within the city so that they can be provided support. And that phone number is 603-589-3456. Again, that's 603-589-3456, and that's our COVID hotline. We also have, as the mayor mentioned, a city website that has all of the information around COVID-19 within the city, as well as links to state and federal resources. And that website is nashuanh.gov/COVID-19, COVID-19. The other thing that we're working to release, and you'll see many of this stuff here within the next few hours, are some great geographical information systems or mapping products and services for the city. One that was created was to track volunteer hours. And with all the volunteer activities that are taking place within the city, it's important for us to document the volunteer hours for our FEMA reimbursement that we'll likely expect here after this is over. We've also put together, in conjunction with our Economic Development Division, some efforts to track those essential employers within the community so we can provide support to them. So there's an essential employers map that you can enter your business or nonprofit organization on so we can identify who you are and how to assist you. And most recently, today, we're releasing the Business and Service Status Reporter. And this is an online tool that enables the city to receive information about businesses, faith-based organizations, nonprofits, and other community services that may be operating in a reduced format or online services only. This is a publicly available map that everybody can go on to and see the status of their favorite organizations or businesses. So together, I think we'll all be able to get through this. As I've mentioned many times in the past, this is something that the city government is not going to be able to handle on their own. It's something that the state government is not going to be able to handle on their own. But working together with our nonprofits, our businesses, as well as all of you, the individuals out there in the community, we will get through this. Thank you.
All right, well, thank you very much.
Okay, question.
Yeah.
Mayor, as you mentioned that City Hall is closed, the buses have been reduced to essentially like call ahead pickup and stuff
Right.
like that. Has the city experienced or is planning to furlough any city workers?
Not at the present time. The bus drivers, only some of the bus drivers are working, but what we're seeking is the ability to, we're seeking FTA, Federal Transit Authority, to pay the bus drivers so that they, even when they're not working, they can get paid.
So are they getting paid now, or are you still waiting for that money?
Of course, some are still working, and we're waiting for word from the FTA.
Okay. But until you get that, they're not getting paid? I don't understand.
We're paying them through, I believe, through Friday, but then.
Oh, you're paying them through Friday?
Yes.
And then they won't get paid until you get this federal money? Is that?
Unless we get word from the FTA that we can pay them.
Okay. And if you don't get word, will they be furloughed?
Yes.
Okay.
But we're doing everything we can to keep them. We are operating the paratransit buses, which you mentioned, the call for ride, but we're also able to employ the bus drivers on the delivery routes where we're delivering food to the kids. So we will keep people working as much as we can that way.
And everybody in City Hall who's non-essential, they're still just working from home?
Yes.
Okay. Thank you.
George?
Mayor, I have a question. Can you tell me a little bit what you're able to do right now to assist Great American Downtown and the Chamber of Commerce so they can help small businesses?
Well, Director Cates mentioned the Economic Recovery Task Force. So we've been examining what's available in the stimulus package passed by Congress, and there seems to be resources we can use to help small businesses keep employees employed. Plus, we're beginning to look at redirecting some community development block grant funds from other projects into a recovery fund that we could use for small business to help small businesses get through the period of isolation.
And one more question.
Yeah.
Yeah, okay. I know that just kind of touched upon this in regard to people being more vulnerable, the homeless population. Can you elaborate a little bit on that, and especially for those that don't have insurance?
Well, certainly anybody who is congregating with others becomes more vulnerable. So I think what I'm going to do is ask Director Bagley to talk about this, because the health department, I mean, the issue is, should we in some way try to bring homeless people that are exhibiting symptoms together? I think public health has some reservations about doing that. So I will let, which Ms. Bagley can explain. So I will turn that over to her.
Thank you, Mayor. Yes, our homeless population is particularly vulnerable, and we have Bob Mack, who is our welfare officer, who's also working with some of the nonprofit organizations to take a look into some of the strategies that can be put in place to address where, if an individual who doesn't have a place to go, and we're telling people to stay at home, where can they reside, or where can they go if they're put on quarantine. So at this point in time, we're working with our nonprofit organization, the Nashua Soup Kitchen, the United Way, to look at strategies for that. There are some things that are being put in place at the state level to address homelessness, and they're working on contracts with hotels. And so we're hoping to hear more information about how that will help us down in Nashua as well. And we're looking at some of those strategies within our community, with some of the hotels here as well. So there'll be more information that comes out regarding that situation.
All right, thank you very much.